Did you know that erectile dysfunction, ED, might be more than just a bedroom issue? It could be a red flag for heart disease? But is this link overhyped, or is it a lifesaver? I've seen how this controversial connection sparks debate. Some dismiss ED as just aging, while others argue it's a critical warning sign for cardiovascular doom. Stick around as we unpack the science, stats, and solutions to resolve this debate and help you stay healthy and vibrant. Heart disease and its link to reproductive health. Hello, gentlemen, on the Vital Men 60 channel. I am Dr. James Edward Carter, here to dive deep into the common health challenges facing men over 60, with a spotlight on heart disease and its surprising ties to reproductive health. At this stage of life, your body is like a well-tuned engine that's been running for decades. It's reliable, but needs extra maintenance to avoid breakdowns. Heart disease tops the list of concerns, affecting millions. And its interplay with issues like ED isn't just coincidental. It's backed by robust research. We'll explore the prevalence, causes, symptoms, risks, and practical steps you can take, expanding on each aspect with detailed examples. The latest 2025 studies, specific data, real-world scenarios, and my personal opinions as someone who's analyzed countless health patterns. Remember, this is educational. Consult your doctor for tailored advice. Understanding heart disease in men over 60, the silent threat and its widespread impact. Heart disease, or cardiovascular disease, CVD, encompasses a range of conditions like coronary artery disease, CAD, heart failure, arrhythmias, and strokes. For men over 60, it's not just common, it's the leading cause of death worldwide, according to the World Health Organization's 2025 update, claiming over 18 million lives annually, with men bearing a heavier burden due to factors like higher smoking rates, stress, and hormonal changes. In the U.S., the American Heart Association's AHA 2025 Heart Disease and Stroke Statistics Report reveals alarming figures. Nearly 47% of U.S. adults have high blood pressure, a key precursor to heart disease, and over 72% are overweight or obese, exacerbating risks. Specifically for men over 60, the AHA data shows that the prevalence of CVD, including hypertension, CHD, heart failure, HF, and stroke, increases dramatically from about 40% in those 40 to 59 years old to 70 to 75% in 60 to 79-year-olds, the CDC's Health United States report. Further notes that the age-adjusted prevalence of heart disease in men decreased slightly from 8.3% in 2009 to 7.2% in 2018, but in 2019, 7.0% of men reported having heart disease, with rates soaring in older demographics. Why is heart disease so prevalent in this age group? Aging naturally stiffens arteries through a process called arteriosclerosis, where plaque builds up, reducing blood flow and increasing pressure on the heart. A 2025 AHA fact sheet highlights that the average age at first heart attack is 65.6 years for males, with approximately every 40 seconds someone in the U.S. experiencing a heart attack. For example, consider a 68-year-old retired mechanic who's smoked for 40 years. He might not realize his occasional chest discomfort during yard work is angina, a symptom of CAD, until it's too late. Studies like the Framingham Heart Study, updated in 2025 analyses, show that men over 60 with a history of smoking have a 50% higher risk of CAD compared to non-smokers. Diving deeper into specific types, CAD is the most common, narrowing arteries with plaque and affecting 40 to 50% more men than women over 60 due to lower protective estrogen levels in men. Symptoms often include chest pain, shortness of breath, fatigue, or even jaw pain. subtle signs that men might brush off as normal tiredness. A real-world example. In a 2025 Neurology Advisor update, prevalence of high blood pressure reaches 76.5% among those 65 and older, directly fueling CAD. Heart failure affects 7.5% of males aged 60 to 79, according to 2017 to 2020 data from the AHA, often resulting from prior heart attacks or uncontrolled hypertension. Arrhythmias, like atrial fibrillation, AFib, have a 10 to 15% prevalence in this group, increasing stroke risk five-fold, as per the British Heart Foundation's 2025 statistics. In my opinion, these numbers aren't just stats, they're a call to action. I've advised many who caught early signs through routine checkups, avoiding major events. For instance, if you're experiencing unexplained fatigue after light activity, like walking the dog, get an EKG. It could reveal arrhythmias and save your life. Risk factors compound with age. High blood pressure affects 75% of men over 60, diabetes 30 to 40%, obesity 40%, and smoking doubles the odds. The JAXA's 2023 study, reaffirmed in 2025, shows men with multiple risks have 2 to 3 times higher chance of heart events by 70. Personally, I recommend starting with a heart-healthy Mediterranean diet. Studies show it cuts cholesterol by 10 to 15% and reduces CVD risk by 30% in older men. Global perspectives add depth. The World Heart Federation's 2025 report notes age-standardized CVD mortality from high BMI ranges from 14.4 to 67.5 deaths per 100,000, higher in low-income regions where men over 60 face limited access to care. In the U.S., non-Hispanic Black adults have the highest CVD rates at 48.6% from 2017 to 2020 data, highlighting disparities. An example from the New England Journal of Medicine 2025 study, lifetime CVD risk is 38% for men with risk factors, emphasizing prevention. The controversial link, heart disease and reproductive health. Unpacking the evidence now, addressing the debate head-on, is ED truly a predictor of heart disease, or is it overstated? The science leans strongly toward yes, ED is a vascular issue mirroring heart problems. ED affects 52 to 71% of men over 60, with global projections reaching 322 million cases by 2025, per Johns Hopkins and AHA reports. The link? Both arise from endothelial dysfunction, where blood vessel linings fail to dilate properly, reducing flow. Penile arteries are narrower, 1 to 2 millimeters versus 3 to 4 millimeters in coronary arteries. So plaque impacts ED first, often 2 to 5 years before cardiac symptoms, as confirmed in a 2025 circulation study. A 2024 PMC study, updated for 2025, found men with ED have 1.6-fold increased odds of CVD events, 16.2% versus 10.3% in 1,549 patients. The Princeton Consensus Panel in 2025 reaffirms ED as an independent predictor, even after adjusting for age, diabetes, and hypertension. For older men, a Frontiers in Cardiovascular Medicine 2024 study shows ED severity predicts CHD severity, with incidence 50-fold higher in 40 to 49, but still 1.5 to 2.5 times in over 60. A Nature 2024 study links low sexual frequency to higher CVD mortality in middle-aged men, suggesting regular activity protects vascular health. Shared risks include diabetes, damaging vessels, and causing ED in 35 to 50% of cases, while doubling CVD odds. Obesity and metabolic syndrome triple risks, per 2025 PMC reviews. Psychological ED ties in via stress-elevating cortisol, worsening atherosclerosis. In HF patients, ED prevalence is 80% due to poor cardiac output, as per Springer 2023. Low testosterone, common in 30% of older men, links both. Deficiency increases fat and inflammation, raising CVD risk. Real examples abound. A 65-year-old with mild ED ignores it, suffering a heart attack. Studies estimate 25,000 to 75,000 preventable cases over 4 years. Another, a diabetic man in his 60s develops ED, prompting cardiac screening that reveals 70% artery blockage, averted by stent. My take: this isn't hype, it's evidence-based. If ED emerges, prioritize a cardiologist. It could add years to your life. Track symptoms like erection quality and discuss openly with your doctor. Further evidence from meta-analyses. JACC 2009. Study shows ED predicts CVD beyond traditional risks. The Journal of Sexual Medicine 2011 meta-analysis indicates ED increases CVD risk by 44%, CHD by 62%, stroke by 39%, and all-cause mortality by 25%. In younger men, under 55, ED raises CVD risk 50-fold, but in over 60, it's still significant at 1.4 to 2.0 times. A 2020 BJU International Review confirms ED as an independent CVD predictor. For heart failure, a 2025 update notes ED as a comorbidity in 60 to 80% of cases, linked to reduced nitric oxide. Gender disparities add nuance. While men face earlier onset, average heart attack at 65.6 versus 72 for women, reproductive health links are stronger in men due to testosterone's role in vascular function. A 2019 PMC review on gender and aging notes declining sex hormones in men over 60 correspond to rising CVD risks. Other common health issues in men over 60 and their interconnections. Heart disease doesn't exist in isolation. It's intertwined with other issues. Prostate problems like benign prostatic hyperplasia, BPH, affect 50 to 60% of men over 60, causing urinary symptoms and linking to CVD via chronic inflammation and shared risks like obesity. Prostate cancer, more common in this age, increases CVD risk through treatments like androgen deprivation therapy, which lowers testosterone and raises heart events by 20 to 30%, per a 2024 PMC study on gender disparities. Low testosterone, hypogonadism, prevails in 30% of men over 60, reducing libido, causing ED, and increasing abdominal fat, a direct CVD risk factor. Example, a 62-year-old with low energy and ED discovers testosterone deficiency, leading to weight gain and hypertension. Treating it reverses both. Osteoporosis affects 20% of older men, worsened by heart medications like beta blockers, increasing fracture risk and immobility, which furthers CVD. Diabetes, at 25 to 30% prevalence, doubles ED and CVD odds by damaging nerves and vessels. Mental health ties in. Depression, common in 15 to 20% of older men, raises CVD risk by 50% through inflammation and poor adherence to meds. Example, a widower in his 70s with isolation develops depression, leading to neglected hypertension and a stroke. Social connections could prevent this. Racial and socioeconomic disparities. Non-Hispanic Black men have 48.6% CVD prevalence, per AHA 2025, due to higher hypertension rates. In low-income areas, access barriers amplify risks. My advice: view health holistically. Treating ED with PDE5 inhibitors like sildenafil may lower heart risk by 13 to 25%, as per BMJ 2017. Start with annual PSA and testosterone checks. Prevention and management. Practical, step-by-step advice. Preventing heart disease and its reproductive links starts with lifestyle. Aim for 150 minutes of moderate exercise weekly. Brisk walking reduces CVD risk 30%, and improves ED by enhancing blood flow. Quit smoking. It halves plaque buildup in 5 years and cuts ED risk 50%. Manage cholesterol with statins if prescribed. 2025 AHA guidelines show they prevent 20 to 30% of events in high-risk men. For the ED Heart Nexus, screen annually. If ED score, via IIF questionnaire, is moderate, get a stress test. Studies show it predicts events. TRT for low testosterone improves libido and may reduce CVD risk, but monitor prostate. Kegel exercises strengthen pelvic muscles, improving ED 40% and supporting heart health via better circulation. Diet. Omega-3s from fish lower inflammation, cutting heart risk 15% and aiding vascular function for erections. Advanced therapies. Low-intensity shockwave therapy for ED improves penile blood flow, potentially benefiting heart vessels. 2025 trials show 70% efficacy. Stem cell injections for heart regeneration are emerging, with early data reducing HF symptoms 20 to 30%. Mindfulness and yoga reduce stress, lowering cortisol and CVD risk 20%, while boosting mood and sexual confidence. Step-by-step plan. 1. Get baseline tests: blood pressure, cholesterol, testosterone. 2. Adopt a diet low in processed foods. 3. Exercise daily. 4th, monitor symptoms weekly. 5. Follow up with specialists. Personally, integrate fun. Join a walking group for social and heart benefits. If diabetic, tight glucose. Control halves ED progression. Conclusion: resolving the debate and empowering your health journey. The ED Heart Link isn't controversial. It's proven. ED predicts CVD with risks 1.5 to 50 times higher, especially in over 60, backed by 2025 meta-analyses and AHA data. Don't ignore subtle signs. Act proactively. With lifestyle tweaks, screenings, and support, you can thrive. Thanks for watching Vital Men 60. Subscribe for more empowering insights.